Well, for more on this topic, let's cross over to Jason Fung, joining us live from Toronto. He's the author of The Obesity Code, Unlocking the Secrets of Weight Loss. Thank you for joining us.
Hi, how are you?
Good, thank you. Now, by some estimates, the number of obese Chinese has doubled in the last decade. Help us understand why China's obesity problem has increased so much in that time.
Well, I think what we have to understand is that obesity has many different causes. So it's not simply one single thing, but there are a lot of different things that can contribute. One of the main factors, though, contributing to it is this increase in highly refined foods. So as countries become more wealthy, they tend to abandon many of their traditional dietary patterns, and as they get busy, they want to buy more convenient foods, foods that come in boxes, instead of fresh foods. And there's a lot of things such as sugar, which contribute much more to obesity than other foods. And you can see that the rates of obesity rise wherever sugar intake also rises. So many parts of China, for example, if you look back to the 1990s, had virtually zero sugar intake. It was very, very low. But now it's one of the fastest growing regions in the world where sugar consumption is going up. And that's contributed a lot to this sort of thing. But also the refining of food. So instead of eating whole foods, people are eating processed foods, processed grains, processed fats, processed meats. Everything is prepackaged, and a lot of the nutrients and a lot of the natural goodness of the food is kind of stripped out of that. And that also contributes to the obesity problem.
So with that being said, you mentioned a lot of issues in the national diet. Is there anything else in terms of lifestyle changes that's really helped contribute to this obesity explosion that we're seeing?
Well, certainly, and it's one of the things that we talk about is a lack of physical activity. That tends to be a relatively minor issue, but definitely as people get busier, they spend more time in front of the television, they spend less time getting out and getting exercise. So that certainly contributes, although it's not as important as most people think. Chronic stress is also a big contributor. Sleep deprivation, for sure, we know contributes to increased hunger and weight gain. So again, as people modernize, as a society modernizes, there's all these 24 hours a day call centers, people are working night shifts, and all these things contribute. People also eat all over the place. They eat in front of the computer, they eat in front of the television instead of a traditional meal, and people eat constantly. If you look at the change in dietary habits in the United States, in 1977, people ate 3 meals a day on average, breakfast, lunch, and dinner. When you go to the 2005 survey, people are eating closer to 6 times a day. And this is not a good news, because when you eat all the time, you're giving your body instructions to store food energy. So if your body's always storing food energy, it has no time to burn off that food energy. And over time, this is going to lead to insulin resistance, type 2 diabetes, and of course, the problem is obesity. You're not burning off those calories that you've taken in.
Now, Jason, with that being said, that's quite a shift from this food scarcity, which used to be a major poverty-related issue in China. So has fast food then become the poor man's diet? Or what are the demographics then?
Yeah, in the United States, for sure, there's a very strong relationship between poverty and obesity. If you go back about 150 years, it's the opposite. It was a rich man's disease. And the reason is that some of these foods that are very, very obesogenic, things such as highly refined grains, flour, bread, sugar, all those are very highly refined, very fattening foods, and they tend to be very cheap. So if you go to the supermarket, for example, you can buy a whole box of pasta and you can feed your whole family, or a whole loaf of bread for $2.99, whereas if you buy some fresh fruit or meat, it will cost you 5 times the amount. So what happens in America,
I'm sorry, Jason, I do want to make sure that we get to some of the issues specifically faced by China.
Sure.
And now, it's not just the rise in obesity, but some of these associated conditions like diabetes, increased risk of cancer, and other issues. So that could really amount to a healthcare policy problem. What is this actually costing the people and the state?
Well, in terms of China, the numbers are actually quite horrifying, because type 2 diabetes is the leading contributor to all sorts of very important health issues: heart disease, strokes, cancer, kidney disease, amputation, blindness, lots of different health disorders. So if you go back to a generation ago, 1980, there's only about 1% of Chinese that had type 2 diabetes. That's gone up to over 11%. So within the space of a single generation, you've got over 10 times the amount of type 2 diabetes.
Right.
It will basically bankrupt the healthcare system, taking care of all these. And that's not even including all the human suffering that's involved with that.
And just quickly, Jason, research shows that there are very few obesity awareness programs. What's a good strategy for really raising awareness and trying to curb this obesity rate that we're seeing?
I think that what people need to understand is the causes of obesity, and it's not simply a matter of calories in, calories out, because we've tried that for many years to tell people to eat less calories and to exercise more. That sort of advice is not particularly helpful. It sounds like it should work, but in the end, we've done it for 25 years, 30 years, it really hasn't worked. And I think there have to be better strategies to help people understand making different food choices can also lead to weight loss. So taking away some of the sugary foods, some of the highly refined foods, refined grains, and getting back to natural foods. And one of the major shifts we've seen in the last 5 or 6 years is this re-embrace of healthy fats.
Jason, I'm sorry.
25 years ago.
I'm sorry, we're out of time. We're going to have to leave it there. But thank you so much for joining us. Jason Fung, author of The Obesity Code.